Not only will we be looking at naming the bones of the skeleton, but we also need to know bone landmarks or bone markings. If you look at any bone in the body, you will notice that there are some pretty intricate features of that bone. We've got holes, we've got larger holes, we've got some hills, some humps, some bumps, we've got things that attach here, things that don't attach here. So those are what we might call landmarks. A bony landmark would be the equivalent of if you needed to have directions somewhere, you might tell someone to look for a particular landmark. And so they would gear their navigation by looking for that feature. We've got the same thing going on with the skull. We've got a lot of features of the skull that are there and have a purpose for being there. So we'll go through some very general landmarks, and then there is a list in this PowerPoint coming up of these specific bone markings and bony landmarks that you will need to know for lab. The first one we talk about is called the body of a bone. So every bone, of course, it has its own unique shape. There are some bones that have a very prominent major part to them, and this would be called the body of that bone. So it's the central portion of the bone. In the case that we're seeing here, the mandible, which is your lower jawbone, has most of its prominence here, the angle of the jaw, and so we would call this the body of this bone. And then we would have other bones that would have a main portion, and that would also be called the body of that particular bone. We also have different openings in bones. When you look at a skull, you will see that there are holes in it. Here's a giant hole, here are some smaller holes, there are even smaller holes than this. And those holes all have a purpose. The two types we will look at, one, a foramen. A foramen, a round hole, and it has a purpose. The purpose is so blood vessels and nerves can pass through that bone to go into the skull, into the brain area, and from the brain outward. So the example we're showing you here, this giant hole that sits at the very base of your skull, it's part of the occipital bone, is called the foramen magnum. In Latin, that translates to great hole. So the foramen magnum, well, what do you think passes through there? Since it's at the base of the skull, it's going to be your spinal cord. And we can think of the spinal cord as one giant nerve. So that fits our definition. It's a hole for blood vessels or nerves to pass through. There are other foramen that are located not only here in the base of the skull, but in other bones, and they too are for blood vessels or nerves to be able to pass through to the skin or inward to the brain and its tissues. A second type of hole could be a meatus. A meatus can also be called a canal, and in fact sometimes you will see this called the external auditory meatus, and other times you'll see it termed the external auditory canal. A meatus is a passageway, usually to the outside of the body in, and so we do have a few meati for plural. This would be this one here. This is your external auditory meatus. It is a hole through the temporal bone, and you actually are probably more familiar with this as the hole in your ear. So if you have your finger and you put your finger in your ear, you just put it in the external auditory meatus. It just so happens that currently it is covered by skin on your body. This is what it would look like if it were not. We can also have depressions and grooves in bones. A fossa is a depression in a bone, and we're going to put a joint in that bone. So the depression is ready for another bone to attach to it. The case that we're seeing here, if we took the lower jaw, the mandible, off of this skull, the two parts of that jaw would fit into the rest of the skull here and here, because where these red parts are is a depression. It's a little well, and we might put another bone there. And so those two bones hook together, and usually there are ligaments that will connect them, and they have formed a joint. So this is called the mandibular fossa, the depression where the mandible fits in to the temporal bone. We could have a notch. A notch is a groove in a bone. It's usually V-shaped, although the shape can vary a little bit. And in this picture, the notch is here where it's a little bit dark, and The notch is also a passageway for blood vessels and nerves. Now, there are some people who have notches where they have this particular item, and then there are some people who have a full hole, which means they have a full foramen. And in this skull, the person had both. They had a notch on one side and a foramen on the other side. But we want those two there because we've got to have a way of getting blood vessels and nerves that are external to the skull into the skull or out of, so that they can communicate with the brain. We have processes. A process would be an extension or an outcropping of bone. And so usually processes can be either from muscle attachment. You can have muscles that will attach to these bumpy, bony outcroppings, or we can even put two bones together there. So we'll see a few different types of these. So here we list the different types of processes you have. Some of them are pretty general and can be found on multiple bones, and then other ones are pretty specific to certain bones in your body. So there's a slide for each one of these different types of processes. Number one would be the head of a bone. So it's usually an egg-shaped type of thing. It's rounded, and it's going to be specifically able to fit into a depression. So in a way, we could say that the head of a bone fits into the fossa of a bone, because remember, we just talked about a fossa being a place where one bone fits into another. So this would be a specific case of that. The femoral head, very easily recognizable. It's a very distinct rounded projection, and the femoral head fits into a very deep fossa on your ilium called the acetabulum. So you have the head of this bone, the head of the humerus would be another. You have the head of the radius. Most of your long bones are going to have a head to them. There's also a condyle. A condyle is a rounded bump. Notice this condyle is not as prominent as the head on the one that we just looked at, but it is a distinct end to the particular bone. So a condyle, this bump, is generally going to fit into a fossa. When we looked at the mandibular fossa, the depression that was part of the temporal bone, and I said that the mandible fit into that, well, here's what we have. We have the mandibular condyle fitting into the mandibular fossa of the temporal bone. So on a skull, if you detach the jaw, you're separating that mandibular condyle from the mandibular fossa, which is located on another bone. 3, we have epicondyles. Condyles we just saw were rounded bumps where two bones meet. The prefix epi means above. So typically condyles are going to be just slightly raised from condyles. And they're also more of a roughened surface because epicondyles are usually for muscles to attach to the bone, not necessarily where two bones attach to each other. So if we look at the humerus, this is your upper arm bone, we see that around the elbow joint, so this would be where your ulna fits into your humerus to form your elbow, we have two epicondyles. We have the medial epicondyle, so this would be the one that when you're standing in anatomical position is closest to your waist. And then we have the lateral epicondyle, which is one that would be on the lateral side, so it would point outward from you. So your muscles of your upper arm attach to these condyles, and they will pull on those bones and make your arm move. Number 4, we have a spine. A spine is generally seen as a pretty sharp, pointed attachment. We can feel a number of spines in the body. One of the reasons that they may feel more sharp than others, it really depends on how much skin and muscle is on top of them. Your vertebrae, if you have ever felt the bumps of somebody's spine, what you are actually feeling is the spinous process of those vertebrae. Or if you have felt somebody's shoulder blades before, you are actually feeling the spine of the scapula. So you're feeling a very sharp outcropping of that particular bone, and it's for muscle attachment. We're going to attach muscles here that will allow for movement. two somewhat specific versions of things that we have talked about. We've talked about bumps for muscle attachments. Epicondyles would be one of those. So could you consider these some pretty giant epicondyles? In a way, sure. The femur has two very prominent humps that are specifically for certain muscles to attach to, called trochanters. So the greater trochanter is the lateral side, and so it's kind of right where you would say is a little bit below the hip. And then there is a lesser trochanter that is on the medial side. And the names come from the obvious difference in size. Greater is much larger than the lesser trochanter. And so we would have the muscles being attached to these two areas. And that's a term that's pretty specific to the femur. And then we have a tuberosity. And a tuberosity is similar to a trochanter, but it's not as noticeable. It's not as prominent as a trochanter. A tuberosity is a small bump, and we don't usually associate it with a condyle. Sometimes when we have muscles being attached, there is a condyle very close to that area. But in this case, we're going to attach a muscle to the tibia, but this occurs long below we have the actual condyles. So the two bones, the femur and the tibia, attach here, and then we've got some space, and finally we get a tuberosity. So your tibialis anterior, which is what most people would commonly call your shin muscle, actually attaches to this tibial tuberosity, and it comes down here. And the interesting thing about the tibial tuberosity is you can feel yours. If you put your fingers just below your knee, you feel that bump that rises out from the very front of your tibia. That is your tibial tuberosity. We have sinuses. Sinuses are cavities in bones. They're hollow. And as much problem as our sinuses give us, the reason that we have them is kind of twofold. One, having these giant hollow cavities in our bones that surround our nose lightens the weight of our skull. If our skull were completely solid, it would weigh much more than it does. So it does give us some air pockets here. And the sinuses are also lined with epithelial tissue that will produce mucus, and it is designed to trap and catch dust and debris and particles and things that we really don't want going down into the respiratory system. And as long as the sinuses are doing their job and they're working okay and they're not overproducing mucus, we generally tend to forget about them. It's when they become infected or when we get a cold that they really start overproducing that mucus, and they're trying to do their job, and sometimes they end up causing more trouble than good. We have frontal sinuses because those are holes in the frontal bone. The biggest ones we have are the maxillary sinuses. If you have ever had sinus pain and you put your fingers on your cheeks just below your eyes, that's where you feel the pain. That's where you're actually pressing down on that maxillary sinus. And then there are some smaller ones in the middle of the sphenoid bone and some little air pockets in your ethmoid bone. So from your studies of the skull in lab, you will have remembered those four bones. This is the list of specific bone markings that you will need to know for the skull and the skeleton labs. So in both of those labs, you will see, especially the skull labs as far as this goes, you will see these things being asked for. So as far as lecture goes and as far as lab quiz goes, make sure that these are specific foramen, fossa, meatai, things that you will be able to identify on bones. And again, you will find those in the skull and the skeleton labs.